I'm Dr. Bragg from the Spine and Orthopedic Pain Center in Norfolk, Virginia, with a tip for a pain-free Friday. In my best-selling book, Knockout Pain, Secrets to Maintain a Healthy Back, I talk about slip disc. Have you ever heard of a slip disc? When you have a slip disc, we grade them up to 4 grades. Obviously, 0% means you don't have a slip disc, but then we grade them from grades 1 to 4. Well, grade 1 means that your vertebrae have slipped up to 25%, grade 2 up to 50%, grade 3 up to 75%, and a grade 4 is more than 75%. So imagine you went to IHOP and you have a stack of pancakes. All your vertebrae should be aligned perfectly. Imagine one of those pancakes falls off. That's the way the vertebrae does. It slips and it's out of alignment. But just because you have a slip disc, it doesn't mean that you have to have surgery. So I want you to read about a spondylolisthesis, a slip disc, so that if you have one, you need to know when you don't have to have surgery. When you have a slip disc, one of the things that you have is pain with walking and standing. So this is a time when you can sit to relieve your pain. But remember, as I've always told you, we don't want to sit more than an hour at a time. But if you have a slip disc, you can find exercises on how to treat it in my book. Remember, this is something that can be treated conservatively. This is Dr. Bragg from the Spine and Orthopedic Pain Center in Norfolk, Virginia, with a tip for a pain-free Friday. Now please, sign up for my YouTube below.